Atopic dermatitis, commonly known as eczema, is a chronic inflammatory skin condition that affects millions worldwide. It's characterized by intensely itchy, red, swollen, and cracked skin, often flaring periodically throughout a person's life. While it frequently begins in childhood, atopic dermatitis can impact individuals of all ages, and importantly, it is not contagious. The primary symptom of atopic dermatitis is intense itching, medically known as pruritus, which can be quite distressing. Other common symptoms include dry, cracked skin, rashes that may as clear fluid, or even bleed if scratched excessively. You might also notice small, raised bumps, especially common in people with brown or black skin, along with thickened or scaly patches. Skin discoloration, appearing red, purple, brown, or gray, is also a frequent sign, varying with individual skin tones. The location of eczema changes with age. In infants, it often appears on the cheeks and outer limbs. For older children and adults, it commonly affects the skin folds, such as inside the elbows, behind the knees, around the neck, and wrists. Other indicators can include darkening of the skin around the eyes, extra skin creases on the palms and soles, and an extra fold of skin under the eye, known as a Denny Morgan fold. The exact cause of atopic dermatitis remains unknown, but it's understood to involve a complex interplay of genetic, immune system, and environmental factors. Many individuals with AD have a family history of related conditions like eczema, asthma, or hay fever, suggesting a genetic predisposition. A key factor is skin barrier dysfunction, where changes in genes, like a mutation in filaggrin, impair the skin's protective ability. This leads to increased moisture loss and greater vulnerability to irritants and allergens from the environment. An overactive immune system also plays a role, causing inflammation in the skin, often indicated by elevated IgE levels. Environmental factors like exposure to certain chemicals, frequent hand washing, low humidity, and cold temperatures can also worsen symptoms. Common triggers include irritants such as harsh soaps, detergents, shampoos, and bubble baths. Allergens like dust mites, pet dander, pollen, and mold can also provoke flares. Certain foods, especially in infants and children, such as eggs and cow's milk, can be triggers. Fabrics like wool or synthetics, temperature changes, heat, sweating, stress, and hormonal changes can also exacerbate AD. While there is no cure for atopic dermatitis, various treatments and strategies can effectively manage symptoms and prevent flares. Education is paramount. Understanding the chronic nature of AD and the importance of consistent maintenance therapy is crucial. Daily skincare is fundamental, starting with applying fragrance-free emollients at least twice daily, especially after bathing, to keep skin hydrated. Bathing in lukewarm water for 5 to 10 minutes with soap-free cleansers is recommended, followed by patting skin partially dry and applying emollients within 3 minutes. Dilute bleach baths, used twice weekly, can help reduce bacteria and prevent skin infections. Wet wrap therapy involving corticosteroid ointment under wet and dry gauze can be effective for severe eczema. Identifying and avoiding triggers is vital. This includes using mild, fragrance-free soaps and detergents and avoiding fabric softeners. Wearing loose, soft, cotton clothing and keeping cool to prevent sweating are also important strategies. Medications include topical corticosteroids for acute flares, applied before emollients, and topical calcineurin inhibitors like pimecrolimus. Topical PDE for inhibitors, such as crisaborole, are approved for mild to moderate AD, offering another treatment option. While oral antihistamines are generally not recommended for itch, they may offer some relief, especially at bedtime. Antibiotics are used to treat skin infections caused by S. aureus, which can complicate AD. For severe cases, systemic agents like phototherapy, cyclosporin, and newer interleukin inhibitors, such as dupilumab, may be considered. Other therapies include light therapy for those unresponsive to topical treatments and allergen immunotherapy to reduce allergic reactions. Lifestyle and home remedies are also crucial, including consistent moisturizing and applying cool compresses to relieve itching. Avoiding scratching by keeping nails short and smooth is a simple yet effective way to prevent further skin damage and infection. Managing complications like skin infections promptly with antibiotics and identifying potential food allergies, especially in children, are essential. Special considerations include hormonal changes during pregnancy that can trigger AD, where probiotics may be recommended. The mental health impacts of AD are significant, making it important to address these concerns alongside physical treatment. Finally, the financial burden of treatment can be substantial, highlighting the need for comprehensive support and resources. Patient education, diligent trigger avoidance, consistent skincare, and appropriate medical treatment are the cornerstones for managing atopic dermatitis. These combined efforts significantly improve the quality of life for patients and their families living with this condition.